Hi, my name is R-Reonnia James, and today we're going to discuss an effective pharmacologic teaching plan. This teaching plan is geared mostly towards neurologic medications, so medications like Neurontin for neuropathic pain, antithrombolytics as it relates to neurologic disorders, and anti-epileptic medications will be discussed. The purpose of this teaching plan is to facilitate the student's acquisition of the knowledge needed to safely administer medications. Before we get started, we're going to test our students' level of vocabulary and pharmacology because it tends to be a difficult course related to the terminology and vocabulary that we use in this class. So we're going to test them. We are hoping, of course, to see an increase in the grade before and after the session, but also we hope that our students at least make a 78 on this test. And for the test related to the specifics of the medications that we'll be talking about, we want our students to make at least a 77 or above. So we're going to take the time out to give them this pretest. Next, after we've taken the pretest, we'll evaluate those grades a little bit later on. But then we're going to watch a video of anti-epileptic medications off of YouTube. So this is about a 10-minute video. The link is actually included in the plan. And we're going to play this in class session to give our students a better idea of how we can translate medications and their administration from the textbook to a clinical setting. So we're just taking them step by step. First, they read their homework assignment, and now we're going to watch a video on the specific medication class that we'll be talking about. And then we'll talk about, after the video, how to bring this information from the text to the hospital. So I hope your video went well. I hope you learned a lot. So now we're going to talk to our students about any muddy points on the reading that still need clarification, any muddy points on the video you just watched. And then after we've discussed that with them, we're going to move on to our objective 2, which is to relate medication administration to the nursing process. We want to talk to them about this vocabulary that we just tested them on. We want to talk to them about compliance and non-compliance, medication errors, near misses, and, of course, the nursing process. So why is our patient non-compliant? Do they not take this medication anymore because they can't afford it at home? Or do they just not like the doctor? Do we need to get a new doctor for them? Why are they being non-compliant with their therapy? Of course, we're going to make sure that this medication is appropriate for our patient's situation. So if our patient is here for let's say a hemorrhagic stroke, we're probably not going to give them their Coumadin anymore, right? So although they were on Coumadin before for anti-thrombolytic therapy treatment, they've had another type of stroke. So we don't need to give them that medication. That may not be appropriate. So that's something we want to definitely call, and if we need clarification on that, we'll call the physician and get that clarified. But whatever the case may be, we want to talk to our patient about why they're being non-compliant with their therapy, with their treatment. We're going to talk about medication errors and how frequently they happen and what we can do to prevent that from happening. So, of course, we want to discuss our 6 rights of medication administration. We want to make sure we have the right patient. So when we go in there to give them their medication, we're going to ask them 2 things: their name and date of birth, right? We already talked about how we're going to make sure this medication is appropriate for this patient. So we're going to tell them the name of the medication. We're going to tell them the dose. You have your 250 micrograms of Synthroid this morning for your hypothyroid. Is that correct? Right. And our patient can say, yes, that's right. My name is such and such. My date of birth is such and such. And this is what I've been taking once a day, every day for the last 25 years. Or whatever the case may be. Is this a pill or is this an IV? We're not going to give our patient sublingual Novolog, right? No, it's subcutaneous. Make sure you have the right route. Make sure you have the right dose, the right medication, that it's appropriate for the patient, that you have the right patient, that you're giving it at the right time. Is this a sliding scale insulin or is this his every HS insulin? So all these things are important to assess because you don't want to bottom him out by giving him 15 units of his sliding scale insulin along with his 10 units of Levemir. So we might have to go through the documentation and hope that the nurse before us has had some good documentation so we can see if a level of 256 for blood sugar is appropriate for a total of 25 units of Novolog. So we can go back in our other nurses' documentation and see what happened the night before. Well, the night before, their blood pressure or their blood sugar was 400. So yeah, they needed all of that. But tonight, we have the same thing ordered, so we might need to go back to our MAR and our physician's orders to ensure that this wasn't a one-time dose, that this is actually something we need to consider, or if this is something we just want to take half of it just to make sure that we're safe for this patient. So all of these things are related to patient safety and administering the best quality of care that you can for each patient that you care for. All right, so we're going to talk about medication errors and near misses. I came into contact with a near miss the other day. I go to give clonazepam to a patient, and where I work now, there's just the generic name. There's not a trade name. So clonazepam, I knew I needed to give. It tells me to go to drawer pocket 15, drawer 2. I pull drawer 2 out. I open pocket 15, and there's lorazepam. That was a near miss because somebody could have been in a rush that day and picked up the wrong medication. And of course, if you're scanning your patient's armband and you're getting your name and date of birth and you're linking it up with the MAR and the physician's orders, you shouldn't give the patient that medicine. So you might have pulled it, but at least you don't actually commit an error. But because it was a near miss, it was my duty, since I found it, to call pharmacy and get them to stock that appropriately and away from medications that could be confused. So we're going to talk about that to our students as well. And we're going to relate the nursing process to medication administration, like I previously said, because we want to systematically plan, implement, and evaluate our patient care. So, of course, we want to start off with a good assessment. Before we do anything, we better know what that patient's vital signs is, what the patient's level of consciousness is, what is their GCS, their Glasgow Coma Scale. Are they awake, alert, oriented ×3? What's the patient's baseline? Before we give them any medication, whether it be Ativan, 1 milligram, IV 3 times a day, PRN, and the patient requests that. Well, I'm not going to give her 1 milligram of Ativan if her blood pressure is 80/40. It's not happening, because although that's a neurologic medication, it could affect the blood pressure. And I don't want my patient to bottom out and have a code blue, right? So we're going to assess the patient's condition, like I said, whether they're taking any over-the-counter medications. You know, patients take, oh, I take aspirin, 81 milligrams, that's just over-the-counter. Don't put it on my home med rec. Not true, because aspirin has an antiplatelet aggregation effect. So we want to monitor our patients for bleeding. Are they taking aspirin along with Coumadin? Because then we really could have a problem. So we want to ensure that our patients tell us all the information that they know, so we can start to add the pieces of the puzzle together with their pharmacologic treatment. Are they allergic to a type of medication? Let's take the lorazepam and clonazepam. She might be allergic to lorazepam and knows that she breaks out in hives, but she's never taken clonazepam before. Are we going to watch for an allergic reaction to clonazepam? Yeah, because those medications are related. They're from the same classification or family, if you will. So because she had a reaction to lorazepam, I'm going to watch her for a reaction to clonazepam, especially if I'm the first one giving this medication. It's the same thing as penicillin. So if my patient's allergic to penicillin and I'm giving her her first dose of vancomycin, I'm still going to watch for an allergy to vancomycin because it's in the same family. So it still works the same way with neurologic medications. It works the same way with medications as a whole. You're going to watch out for that. So now we're going to talk about analyzing nursing diagnoses. My patient, let's say she was admitted with a stroke and she has confusion, and it's in her documentation. The physician has recorded in her notes that the patient is confused. It's part of her admission diagnoses. Can I say in my nursing notes, patient is confused as a nursing diagnosis? No, because I've taken a medical diagnosis and put it in my nursing notes. It doesn't work that way. I have to make sure that I include nursing diagnoses. So I can say my patient has altered mental status related to medical condition, okay? Or I can say my patient is at risk of injury related to altered mental status, okay? So this is just kind of like a creative way to take the medical diagnoses and transform it into a nursing diagnosis that can be documented under the nursing tab. Okay? So, of course, we're going to set goals at the beginning of our shift for our patient. Let's just say our patient has uncontrolled pain or whatever the case may be. We want to make sure we document that patient's pain score and that we work throughout the day to give them the necessary treatment. Okay? We're going to set priorities. Now, we know pain is not a priority. If it comes between life and death, I can deal with your knee pain, but you're not going to die. So we're going to get the life-saving methods, the life-saving medications on board first, and then we can discuss your pain. Not that pain's not important, it's just not as important as your entire life. Okay? So, of course, we want our patient to be free from injury, and especially related to neurologic medications. Those neurologic medications can even exacerbate your mental status and, make you a little bit more confused and disoriented. So we definitely want to watch them. Even if it's something like Ambien at nighttime to help you sleep. We know those people that take Ambien and they wake up with nightmares and just, totally belligerent. It can have the opposite adverse effect. So we want to watch them. Even if we're giving something to calm them down, we want to watch for an adverse reaction. Definitely we want to talk to our patient about pulling up the medication, our students about pulling up the medication and making sure that, like I said, you have the right route. So how do you dilute a medication? How many milliliters of saline? Usually, for just purposes of teaching the students, you want to say about 5 cc's of normal saline to mix in your Ativan with. Ativan is a thick medication. You want to make sure that it is not going directly into the patient's venous line. So you want to make sure it's diluted. You want to assess for effectiveness, assess for a change in vital sign, assess for a decrease in pain, and like I said before, assess for any adverse reactions. Like I said, going back, making sure you have caught up with all your 6 rights of the patient, acknowledging that this is the correct patient. You want to administer the medications with your student whenever you take your student to clinical. If you are that instructor who is to be assigned to follow your student to that setting, be sure that you're there with them and you're going over the information that we talked about. So today we pretty much, in a nutshell, talked about our teaching plan. We've watched YouTube videos. I have another YouTube video which talks about antithrombolytic therapy that you could watch before dismissal of the session today. And I really like that video because it goes in depth about antithrombotics. But what I feel is most important is that's not a neurologic medication. Right offhand, Coumadin is not a neurologic medication. However, I want my students to see that although it's not in that classification, it can be used for that purpose. So today in class, so far as specific medications that we've talked about neuropathy medications, Neurontin. I have some NCLEX questions that are extra, kind of like freebies. You can include them in your PowerPoint discussion when talking about these medications specifically in class. But overall, I feel like we have successfully talked to our students about how to properly administer medications in the clinical setting. So at this point, we can talk a little bit more if our patients or if our students are confused. We can talk to them and clear up some muddy points. And if not, we can actually have our students to think of some questions to bring to our next class session. At this time, we're either going to put some clinical practice into play or we're dismissed for the end of today's session. Thank you.